It's my pleasure this morning to introduce Professor Xavier Soler. Dr. Soler received his degree in medicine and surgery from the University of Barcelona in 1980. He did his fellowship in intensive care medicine at Hospital Vall d'Hebron from 1980 to 1985. He received his PhD in medicine and surgery, summa cum laude, in 1995. Dr. Soler was a consultant in intensive care medicine at Hospital Vall d'Hebron 1985 to 1990 and Hospital Universitari Hermans Trias y Pujol 1990 to 1995. He has been the director of the ICU at Teknon Medical Center from 2009 to present and director of Bloodless Medicine and Surgery Unit from 2010 until today. Dr. Soler is a member of the European Society of Intensive Care and medical director of Masters in Transfusion Medicine, Universitat Politécnica de Barcelona. Dr. Soler is also on the board of the Maturity Assessment Blood Management Project. Dr. Soler will be presenting Bloodless Medicine Education Experience from Spain. Dr. Soler.
Hi. First of all, I would like to express my gratitude to the organization and especially to Dr. Rizzolo for his kind invitation to participate in this event. I'm very excited about these initiatives. I know perfectly the effort that's mine. Okay, Medicine University around 1980s. There are only isolated initiatives that began to emerge to provide medical and special surgery care to patients of Jehovah Witnesses religion denomination. These kind of initiatives were only individual, are absolutely lonely, based on the voluntarism of some people and without absolutely any support from the public administration or the hospital management. Often all these initiatives were misleading and deceitful. On those years, there are a very paternalistical vision of the medicine, and there are not important values attached to the principle of the patient voluntarity. The situation of being confronted with a patient who expresses his refusal to administer blood product will produce a generated university rejection until all the professionals of medicine. And the most common response of the professionals of medicine was to consult a judge. And the consultation to the judge was waiting to release the responsibility from the doctor and the hope that the judge will violate the principle of the patient of the autonomy and authorize the administration of blood products to the patient. The situation was aroused even in the case of minor surgical procedure, and the invocation of the section of the principle of autonomy was seen by the medical profession as a provocation to his authority and the performance of his work. That was accompanied by very little or known knowledge of the part of the doctors and surgeons of the utilization of the blood products. Because if you examine exactly what's the formation of all the physicians, we must know that here in Spain, the university training during 6 years. During 6 years in the curriculum in the university, there are only 2 hours of the specific training in transfusion medicine. 1 hour is devoted to ABO typing, another hour is devoted to microbiological safety of the plasma derivatives. Doctors in his fellow formation were training in the use of the blood derivatives only by the experience of his colleagues, of his tutors. And those people that have very few formation of medical transfusion. Unfortunately, at the present time, the situation has not changed. In my opinion, it's very essential to incorporate transfusional medicine as a subject in the curriculum on the University of Medicine. Because what's happened with the other patients that are not Jehovah's Witnesses? The physicians see the blood products were obviously perceived by as safe, effective, free of side effects, life-saving and indispensable in routine medical practice. The transfusion level of 10/20 was mandatory, and plasma was widely used to correct coagulation, as a blood volume expander, as a supply of coagulation factor during intraoperative surgery, and etc. The situation, unfortunately, did not change in the decades that followed as these individual initiatives came and went, becoming not consolidated at that time. What are the first steps in PBM? In 2005, the Anemia Working Group Spain was created at the initiative of some professionals, including Dr. Muñoz from Malaga, Dr. Abisbe from Barcelona, Dr. Quintana from Madrid, Dr. Pereira from Barcelona. OG was born as a multidisciplinary group from the study of the anemia related to the patient, with the participation of the anesthesiologist, hematologist, intensivist, and biochemist. His main objective is to study the physiopathology and the anemia associated with the surgical patients. The evaluation of clinical laboratory parameters useful in the definition and diagnostic of the different types of anemia present in the pre- and postoperative period. The analysis of the clinical repercussion, quality of life, and socioeconomic impact of postoperative anemia. The study of different therapeutic approaches with emphasis of their cost effectiveness and their capacity to reduce allogenic transfusion. This group vocation is not only research, but also training and consultancy. Its training project includes an annual congress, the development of treatment protocols for preoperative anemia, intraoperative and postoperative blood salvage, and the treatment of postoperative anemia. At the same time, an online training program was developed to update the treatment of anemia and transfusion medicine. What's the position of the scientific societies? The Spanish Society of Intensive Care Medicine created the Working Group of Blood Products and Transfusion in 2003. It currently actually has 17 active members. The aim of the group is the dissemination of knowledge and the promotion of the research and training in their areas of interest, that is, hematologic disorders, processes associated with hemorrhage and thrombosis, treatment of these disorders and processes, massive hemorrhage and massive transfusion, and patient blood management programs. They make a lot of research. Actually, there are the program of Nexus to determine the impact of routine blood extraction, the PlayCrit, that is a program to recording the use of platelets in critical patients. Also, they make the program of training. They will redact a book, Coagulopathy in the Critical Patient. They make the casting courses, is a patient of blood management and casting workshop, and the hemacrit courses devoted to the coagulopathy in patients with massive and critical hemorrhage. They write a lot of documents, as the document of preoperative operative management of antithrombotic measurement, the update of the civil document, that's the PBM program devoted in critical care, and document in the anemia in critical ill patients. The Spanish Society of Anesthesiology created in 2010 the section of hemostasis, transfusion, and fluid therapy, and in 2021 was created the working group in patient blood management. Here in Centro Médico Teknon, in 2010, we presented to the management of the hospital a program devoted to providing medical and surgical care in all specialties, covering both minor and complex surgery to patients of the Jehovah's Witnesses confession. This project included the voluntary incorporation of a specialist of recognized prestige and extensive professional experience in all medical and surgical specialties. The drafting by legal department of relevant documents concerning informed consent and transfusion refusal, and development of protocol for the detection and treatment of preoperative anemia, the reduction of the preoperative bleeding, and the improvement of tolerance to postoperative anemia following the three-pillar PBM model implemented in ISA-BM. In addition, a follow-up to the CBM, we developed a Patient Blood Management Awareness Week project for all hospital staff and patients. During this week, lecturers explaining the PBM concept were organized, and leading specialists from Europe and the USA were invited to participate. The Awareness Week was held annually in between 2011 and 2019 until we were convinced that its concept has become sufficiently well established among the medical and nursing staff of the center. At the same time, the 2-year online master in transfusion medicine was developed, of which 3 editions have been held so far with a great success in the terms of enrollment. Here you can see some of the programs that made of blood management in different years. Finally, we developed the maturity assessment model in PBM. This was designed in 2014 with the aim to helping hospitals to adapt their clinical practice to reduce unnecessary or avoidable transfusion and thus improve health outcomes to the patient. The MPBM objectives that was created here in Barcelona with the help of Dr. Abisbe, Dr. Corominas, Dr. Abasora, and myself were identify transfusion variability by procedure, assess the maturity of existing clinical practices to avoid overtransfusion, facilitate the implementation of the different components of a PBM program, continually evaluate the outcomes of clinical and transfusion process and the clinical evolution of patients, monitor the degree of implementation and extension of its PBM programs, benchmarking with other hospitals, facilitating the communication between medical teams and management in the implementation of PBM and monitoring the results. The analysis model is based on the maturity matrix that included organization, is a structural model in organization, training, and information systems, processes based on the TPPM, 3 pillars of the PBM, applied in 7 surgical procedures with high consumption of blood derivatives, transfusion index adjusted by casualty and comorbidities, and the outcomes, mortality, length of stay, complication, 30 days of readmission. The maturity of every hospital is classified in 4 stages: basic, initial, advanced, and excellent. These were the indicators that we use to evaluate the maturity of every hospital. That's including the percentage of patients with perioperative visit, the percentage of patients with iron metabolism and inflammation parameter requested, the percentage of patients with perioperative anemia treated, the percentage of patients with ferritin deficiency with or without anemia treated, and etc. And that was applied to 7 procedures: total hip replacement, total knee replacement, cardiac valve surgery, open colon neoplasia surgery, laparoscopic colon neoplasia surgery, and gastrointestinal bleeding and femur fracture. At the start, in 2015, there are only 9 hospitals included in the program. Then in the next year, we arrived to 21. Next year, we arrived to 35 hospitals. Next, in 51 hospitals. The next one in 54 hospitals. In 2020, 64 hospitals. In 2021, 76 hospitals in all the space, in every province of the space were included in the MPBM program. And what can we see? That's that we show the transfusion rate in 2017. In 2017, as you can see, there are a lot of dispersion of the transfusion rate for hip replacement, for hip and knee replacement, for neoplasia of rectum and colon, for laparoscopic surgery of rectum and colon, for the hair surgery of valvular disease, and the femur fracture, and for the digestive hemorrhage, for gastrointestinal bleeding. In this important number, near to 45,000 patients, we can see that there are a very high dispersion and very high number of transfusion rate for each process. You can see in cardiac surgery, there are some hospitals that derive 90% of the transfusion rate for the heart valvular replacement. In 2021, we can see that there are a very important reduction of the transfusion rate in all the processes, and the less dispersion of the rate of transfusion between the hospitals. If you can see some dispersion more important in some hospitals, were probably devoted that's the hospitals that are included for the first time. That's a big show that the formation in the hospitals, they included in a very serious program of the control of the transfusion rate and the good use of the blood products, that results in the very important decrease in his blood products. When we study the structural matrix of maturity, that it's, as I explained previously, it's divided by organization, formation, and systems of information with a questionnaire in every aspect, that they made an average of every hospital, and we divided in four levels. Basic, when the hospitals arrive and less than 25% of compliance, intermediate between 25 and 50%, advanced is 50% to 75%, and excellent, that it's a compliance of more than 75%. We can see that in 2016, there are one hospital that's arrived only a basic level, and the most part of the hospitals are in the initial level, and someone in the advanced level, but anyone arrives to excellence. What's happened in 2021? As you can see, there are any one hospital that is in the basic level. The number of the intermediate level is increased. The number of the advanced level is very well increased, and a lot of hospitals have arrived to the level of excellence. In numbers, we can see that in 2021, 22% are placed in the intermediate level, 46% arrive to advanced level, and 21% of the hospital, they arrived now to the excellence. What is our experience in the influence of the program of patient blood management? Here you can see the evolution of blood product consumption, explained not by us, by the Banc de Sang of the sheets, that it's the state organization that's provided the blood products to all the hospitals in Spain. In 2010, we consumed 3,800 units of blood and 3,165 units of plasma. In the next year, to start a program of PBM, we reduced the number of the unit of blood to 2,416. The explanation of this important reduction is based on the put and severe order to transfuse the unit one by one. Only by this measure we accomplished this important reduction. Then in the time we have a very important reduction, and in 2018 we arrived to a plateau with the use of blood products of 1,225 units of blood and only 490 units of plasma. And what the activity generated until end of 2021, only in Jehovah's Witness population, we see more than 6,000 hospitalization patients with almost 23,000 of hospital stay, more than 4,000 scheduled surgical procedures, more than 600 urgent surgical procedures with a surgical mortality of 0. And we perform 479 births between cesareans and normal parts. Okay, and we can see it here, the evolution of the surgical activity that remains a normal activity, so less 2020 by the pandemic that decreased severely our activity. As example of activity, we can show the activity in cardiac surgery in our hospital. Until 2021, we have 142 patients has been operated cardiac surgery with a low error score of 27 and very high error score of 25. This kind of procedure was isolated cardiovascular bypass, where only 54 and 24%, valvular replacement 40%, combined valvular and cardiovascular bypass is 8%, surgery over aorta and 10%, including 3 patients with a type A aortic dissection, and miscellaneous of 7%, and redo procedures 8%, and all of that with a mortality of 0. What's the message, in my opinion, to take home? It's essential to incorporate transfusion medicine as a subject in the curriculum in the university. An effective PBM program requires the involvement of all elements of a hospital. The implementation of a project similar to the PBM is an effective element, but not enough. To improve the result of the rational of blood pressures, the involvement of the state on the super state structures is essential. PBM program is a program that is made by a lot of people. In the name of all the people included in the PBM hospital, in my hospital, I want to appreciate your attention and say thank you very much. My pleasure.